Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. Jesus Christ. Let me just keep going. Welcome to another episode of Based on a True Story. My name is Rafael Omar, and today we've got what might just be one of the most disgusting stories I've ever come across online at all. And I've come across a lot of disgusting stories. I want you to pay attention to the verbiage used. Whoever wrote this did such a great job at describing the scene. It's about a nurse who gets called in due to an emergency, and what she finds, I assume it's a she, it might be a he. What she finds is it's a patient who leaves a lasting memory with the nurse and with all the other staff that was involved with this patient. But enough talking about it. Let's get into it. I was on call one night and woke up at 2 a.m. for a general surgery call. Pretty vague, but at the time I lived in a town with large populations of young military guys and avid meth users, so late night emergencies were common. When I got to the hospital, a few more details awaited me. Perirectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the anus, there was a pocket of pus that needed draining. Let me read that again, just in case you didn't quite catch that. I'm gonna read that one more time to you. This means that somewhere in the vicinity of the anus, there was a pocket of pus that needed draining. I just want to take a moment to say thank you to all of the nurses and health practitioners who have to deal with this kind of nonsense, because God knows I can't do that. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Among healthcare professionals, vague statements like that are a bad sign. My patient was a 314-pound Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically from side to side, moaning in pain, pulling at her clothes, and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning. So after I confirmed her identity and what we were working on, I figured it was best to just get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot. Chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch, simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I've been working in healthcare for several years already, mostly in psych and medical settings. I've watched an 88-year-old man tear a 1-inch diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've even been attacked by an HIV-positive neo-Nazi. I've seen some stuff. The other nurse had been in the OR as a trauma specialist for over 10 years. The anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun gloves. The surgeon was ex-Army and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, with a little bit of pus seeping through, but it was all pretty standard. Her chart was noted that she'd been injecting IV drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs. However, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon stepped up with the scalpel, sank just the tip in, nice, And at that exact moment, the patient had a muscle twitch in her diaphragm, and all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. Jesus Christ. Let me just keep going. The godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wore waterproof gowns, face masks, gloves, hats, the works, all of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall. But by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of that blackish gray-brown fluid onto the floor until, within minutes, it was seeping into the other nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tippy toes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out. She tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of despair and apathy that permeated this woman's life. The anesthesiologist went down next, an ex-NCAA D1 tailback, his 6'2" frame shaking as he threw open the door to the ER suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist kept playing in my head. In all operating rooms everywhere in the world, regardless of whether they are socialized or privatized, secular or religious, big or small, there is one thing that is the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is. Everyone knows what it is for, and everyone prays to their gods that they never have to use it. In times like this, we rub it inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to our central supply, ripping open the drawer where the vial of ambrosia was kept, and was greeted by an empty effing box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil and not replaced a single freaking drop of it. To this day, if I figure out who it is, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I find, just so we're even. I darted back into the room with the next best thing I could find, a vial of mastisol. Am I saying that right? Mastisol, M-A-S-T-I-S-O-L, mastisol. Hope I'm saying that right. Which is an adhesive rub we sometimes use for bandaging. It's not as good as peppermint. But considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. It's my God. Bovine afterbirth and maple syrup is a combination that I never thought that I would ever hear uttered. But I can picture it. I can visualize it. The description is phenomenal, and I pray to God that I never have to deal with that in person. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we had just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to the machines long enough to make sure this woman didn't die on the table. It wasn't until later when we realized that mastisol can give you a mild high from huffing it like this. But in retrospect, that's probably what got us through. By this time, the smell had permeated out of our operating room suite and down the 40-foot hallway to the front desk, where the other nurse sat. eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh, so dirty. I stepped back into the operating room suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy in blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's butt and there was no Yoda. He and I didn't say a word for the next 10 minutes as we scraped the inside of the abscess until all the dead tissue was out. The front of his gown was a gruesome mixture of brown and red. His eyes squinted against the stinging vapors originating directly in front of him. Listen, I told you, whoever wrote this, bravo. Not only are you a great nurse, apparently, but you're also a great writer. I mean, the visuals are crazy here. I finished the required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped the woman's buttocks closed to hold the dressing in for as long as possible, woke her up, and immediately shipped her off to the recovery ward. Until then, I'd only heard of alcohol showers. It turns out that 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it is soaked into your skin. It takes about 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little bit of it too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I've ever heard him utter in 2.5 years of working together. That was bad. The next morning, the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all the fluid and debris left behind. The operating room suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen nothing, kid. My God, that has to be the worst story I've ever heard of anything ever. Oh, yeah, that's crazy. The first thing that came to my mind is you hear parents telling their kids what they can go to college and be. What do they always say? The first 2 out of their mouth is always, you can be a doctor, you can be a lawyer. But you never really think about what a doctor has to go through in that profession. In fact, I actually thought about being a nurse for a tiny little bit. I remember there was a guy who became a nurse, and the way he was describing the profession, he was just like, nursing is great, as long as you're okay with dealing with a little bit of blood, a little bit of bodily fluids, a little bit of death, it's a good profession. Why? No, I can't do it. I realized this thinking back on changing diapers. Changing diapers, I could barely touch the diaper. I would hold the diaper like this and toss it away. If I can't change a baby's diaper, ain't no way I'm doing this. Man, shout out to all the nurses, man. See, that's why they make the money they make. Though I do hear that the turnover rate for nurses is crazy high, which I now see why that's the case. 314 pound, it ain't happening. Let's go to the comments. Seeges Christ says, bovine afterbirth and maple syrup. Been an EMT for 2 years now and had my fair share of WTF is this fluid calls. And that was by far one of the best descriptions I've ever heard. That being said, I gagged. I would agree, Seeges Christ. Something facetious said, on the upside, she probably lost some weight that day. Judging by the amount of fluid that this lady has described, that this nurse has described came out of this woman, I would say she lost several pounds that night. She said 1/3 of the floor was covered in fluid. Imagine having enough fluid in your body to cover 1/3 of the floor of an operating room. That's a lot of fluid. Deleted says, that surgeon is a freaking boss. People puking behind him from the fluid in his socks, and all he does is stand on tippy toes. Boss. I would agree with you. Deleted. Again, shouts out to the surgeons, shouts out to the nurses. To everybody in the medical field, God knows I couldn't do it. And I don't think most people could do it. So you are a special breed of person. That's all we got for you today. Remember, if you got a crazy story that happened to you, go ahead and send us the email. The email is in the description. Let me know the crazy story that happened to you, and you might see it on the channel. You might even see it made into a film. By the way, we make films. But that is it for today. I will see you in the next one.